welcome back to my channel. The Arab Nurse here. Today we are going to perform the assessment of the eyes. We have with me Imani, my sister, as volunteer. So let's get started. We are going to need a pen light in order to perform the assessment. The first step is inspection. We are going to look at the eyelids, the sclera, which is the white portion of the eye, the iris, the conjunctiva, and the pupil. The sclera should be white and shiny. As you can see, her sclera is white and shiny on both eyes. There shouldn't be any yellow. If there is any yellow present, it could indicate jaundice. We are going to check the conjunctiva by pulling down the lower portion of the eyelid. As you can see, it's nice and pink. There shouldn't be any drainage present. Then we will look at the eyes. How do these eyes sit in the eye socket? Are they equal? Is the patient cross-eyed? As you can see, this patient's eyes sit evenly into the eye socket and no sign of cross-eye present. In order to test her visual acuity, we will need a Snellen chart that we performed before the assessment, but we don't have a Snellen chart right now, so we're just going to say her vision is 20/20. Now we will test cranial nerves number 2. Now we will test her peripheral acuity. This is also testing cranial nerve number 2. You're going to tell me when you can begin to see my hands, okay? So we're going to go ahead and begin. I can see. I can see. I can see. I can see. Perfect. So her peripheral acuity is intact. The next step, we are going to test for cranial nerves number 3, 4, and 6. First, we are going to look for any involuntary shaking of the eye called nystagmus. We are going to take the pen and hold it about 12 inches away from her nose. Imani, keep your head looking straight forward at that wall. Straight. Using your eyes to watch where I move the pen light, we will perform it in the 6th cranial cardinal field of gaze and move it again, looking for any involuntary shaking of the eye. We're going to go ahead and perform this. So you're just going to follow my pen. Perfect. We will check to see if her pupils are reactive to light. We are going to dim the lights and have the patient stare at the wall, looking at the pupils to ensure they constrict. We are going to go ahead and begin coming with our pen light from the side. First, so you can see the pupils constrict, and then the eyes are going to dilate again, and then we're going to go to the other side. As you can see, the pupil has constricted. Her pupil size normally is 3 millimeters. After constriction, it shows about 1 millimeter. Because the light was dim, I'm not sure if the demonstration showed how the technique is performed, so I'm just going to show you guys. You take your pen light and you come in from the side. And you take a look at it, and then you go over to the next side, from the side, and then you shine your light inside. Both pupils react to light. So both pupils constrict and react to light. Next, we will check for accommodation. The patient will stare at the wall to help dilate the pupil. So if you can just look straight forward. We are going to take the pen light and move it inward and slowly to the nose. You are looking for the pupils to constrict if they accommodate and eyes cross while looking at the pen light. So, Imani, can you go ahead and follow my pen light? We're going to move it towards the nose. and back. And back. Perfect. We can now document that her pupils are equal, round, reactive to light, which that is what PERRLA stands for. This concludes the end of our assessment. Thank you for watching, and if you're requesting any other physical assessment videos, please put it down in the comment section. Bye-bye.